First I had TB, and TB put me down. And you know, once you are down, everything stops. Then from there, multiple complications, poverty, all that.
Across much of Africa, there is a plight of pain and suffering. Famine, war, civil unrest, disease. Many nations struggle to provide even the most basic support for their people. Uganda is one such nation. Since the fall of Idi Amin and a civil war, Uganda has struggled to provide adequate and affordable health care to its 32 million inhabitants. The average life expectancy is 54 years. In sub-Saharan Africa, more than 20 million people are living with HIV/AIDS, and there are over 15 million AIDS orphans. In Uganda, in the 1980s, 30% of the population were infected with the AIDS virus. Now, a rare success story in Africa, the number is closer to 6%. But still, over 60,000 people die of AIDS-related illness in Uganda every year. Cancer is also prevalent. In the country villages, there is only one doctor for 50,000 people.
There's only one cancer centre to serve over 30 million people, one trained oncologist, one radiotherapy machine.
Throughout Uganda, nearly 100,000 cancer patients need urgent access to basic pain control. Due to the lack of medical services, extreme poverty and poor education, tumours can disfigure, rupture and cause unimaginable pain. This film documents the scourge of cancer in Uganda and the devastating effects caused by the lack of treatment and pain control. With only one treatment centre in the capital, Kampala, chemotherapy and radiotherapy is unavailable to most. One hope for those suffering from cancer is work done by the hospice movement, in particular Anne Merriman and the organisation she helped to create. Hospice Africa Uganda has been building a unique palliative care service for the past 20 years.
When we work out the number of people in Uganda at the moment who need pain control at this moment, it's something like 200,000 people. Now, we have one doctor to 19,000, but in the villages it's 1 to 50,000. To them, cancer means pain and a terrible, terrible death.
This former nun is regarded as the pioneer of the hospice movement in Africa. In 1990, she was appointed the medical director of Hospice Nairobi, and during this time, she realized the extent of the suffering and the lack of care available for patients dying with cancer in Africa.
People were suffering all over Africa without any pain control, some of them screaming actually, and the families having to put them far away so that even the family carers could sleep at night. And I realized that this was something that had been going on for all these years. We really needed a model that would be adaptable to the cultures in Africa. And so I left Nairobi Hospice and spent a year trying to get together a group that would support us to start, and also to find out which country we would start in.
Although a poor country, Uganda has a good climate for agriculture, favouring the production of such crops as bananas, sugarcane, coffee and tea. It was here that Anne Merriman convinced the government to let her establish a model for hospice care for the whole of Africa.
We chose Uganda because it had just come out of war. The people were very, very enthusiastic and very caring for each other. And although there was you could see it was a poor country and you could see bullet holes in the buildings in Kampala, there was a feeling of hope in the country, and they had the trust of the international community, so we knew we'd be able to get funding. The three objectives was, first of all, to care for patients, and this is what we call clinical care. the patient care, was to care for patients who particularly had severe pain, were critically ill in the home, or were at the end of life. The second one was to have training so that every health worker throughout Uganda would be able to manage a patient or at least refer them to the right service. The third one was to be a model for the rest of Africa.
Stanley Kasigazi. He's 58 old with cancer of the prostate, and when he came, his major problem was bone pain of the lower limbs. Being on bed all the time, he's feeling like everywhere it's painful, because since May has been bed bound, so he's feeling everywhere.
I'm feeling badly in the whole body. I'm now feeling badly.
Okay, the problem now, because he has that pain, he ran out of drugs.
Before you can do anything else for a patient, you must have pain control, particularly patients who are critically ill or are coming towards the end of life. We have people coming here who are screaming or have been in agony for months and haven't slept for months. So the holistic care that is so necessary to give to patients who are so critically ill is impossible, because they can't even think of making peace with their friends, with their families, or with their God in this situation. And we can't even talk to them about the other problems. So holistic care is almost impossible unless we have pain control.
Cancer in Africa, for most people, means very poor access to the treatments that we would consider fairly standard in Western societies, chemotherapy and radiotherapy. Survival rates are very poor. Many people will present with at a very late stage of their disease. So for a great proportion of people with cancer in Africa, palliative care is the key intervention. If we can do that, we can address symptoms and problems that patients are having.
He's okay now. The pain is coming down.
Okay. Now, are the children, she has 2 children, one is 6 and one is 3.5. Are they at home with her, or are they with the father? The cancer patients fall into 3 groups. The first group are those who have seen a relative with the same condition, and they say, I'm going to die, and they stay at home, and they suffer. The second group goes to a health center, and either the health center says you have cancer, you're going to die, and the same thing happens, or the health center treats them, gives them antibiotics or whatever, which doesn't help. So they're suffering at home quietly. And then the third group might go to a bigger hospital in Masaka here or near their home, and the doctors say, oh, you have cancer, you need to go to Kampala. And as they say, they go home. You might as well tell them to go to London.
The cornerstone of this kind of care is pain control. For the dying, dignity and comfort often means prescribing powerful drugs, of which the most important is morphine. Since it is derived from opium, it is a controlled drug, and many governments refuse to make it available for medical use, due to an unwillingness of authorities to introduce drugs that are considered to be addictive. So most Africans dying with cancer or AIDS suffer severe pain without relief.
Morphine is a a very symbolic drug. It's surrounded by fears and anxieties and almost a kind of demonology. So what we're seeing is an over-bureaucratic approach to the regulation of morphine, the fear that it will fall into the wrong hands and be misused. Will it be stolen? Will it be used by people for non-medical purposes? And you see this working through in the way that governments regulate its use, in the way that physicians think about how they use it, and also in the eyes of patients and those who need it.
This is the centre of operations of Hospice Africa Uganda. It provides clinics for patients who are well enough to travel and a daycare centre. Since 1993, Hospice Africa Uganda has opened 3 care centres across the country, in Kampala, Mbarara and Hoima. Nearly 1,000 people with cancer or HIV/AIDS are on the hospice programme. Another 1,500 patients have access to pain control from medical workers trained by Hospice Uganda. Home care teams leave from here each day to visit the patients who are too unwell to make the journey to the centre.
The idea of visiting patients at home is really intended for the very ill people who are simply too unwell to either travel to a clinic or to any other healthcare facility. And oftentimes those people will be bedbound because of their illness. So the teams will travel out, will visit at home, see how the person has been since the last visit, see how the family are doing, and depending on what issues present, will prescribe and leave medication with them.
Grace is 38. She knows she is dying with terminal cancer of the cervix. Her father died a week ago, and the family are still in mourning.
So how much are you taking?
2.5.
The one I told you?
Then at night she told me 5, yeah.
So how many times, how are you taking it?
In the morning, at around 10, at 2, then at 6, then at 10.
To understand your weakness and your pain that you have, that I cannot of course understand with, because it's not me suffering, then I want you to gauge it for me. Like if 5 being the worst, like as too much weakness, and 1 being the least, like 1 out of 5, or 5 out of 5 being the worst. So where would you gauge your weakness?
4.
4. And
because when I'm down like this, at times I feel myself going, finding myself totally weak. I have to get up, sit a bit, relax.
Despite her father dying of cancer, Grace's mother and grandmother do not understand her illness. They are worried she is not eating and her condition is deteriorating.
She's saying that the main worry now, she does not eat, she does not drink, so they get worried. They should understand why you're not eating much and when you're not drinking much, and your stomach is growing big and big. So is it okay if I can talk to them?
It's okay.
It's okay. Kansa asobola okukwata ebbeere, asobola okukwata eriiso, owa Grace yakwata ku nnabaana. Eyo cervix. Oyinza okubuuza lwaki oli akyali wate Grace muno beera nga buli kanaku mulaba aliki tekimulaba.
After negotiating with the government, Dr. Merriman managed to get a license to import the much-needed morphine.
One of the big problems in providing any kind of healthcare in Uganda is the cost. Resources are extremely limited, and one of the drugs we absolutely need to have to provide palliative care is strong pain medicine. And what Dr. Merriman found when she started first was she'd had access to a formula for making up morphine, which she'd first learned in Singapore. But it means that morphine can be made up quite cheaply in Hospice Africa Uganda through importing powder from Europe and then reconstituting it with preservative and food dye in Hospice Africa centres.
We use now about 2 kg a month, which costs about nearly £3,000 a month, but in fact, when you work it out for the patients, it costs the price of a loaf of bread for medication for approximately 10 days for the average patient. Our average patient is taking 30 milligrams a day. It means now that the patients can go home and have their pain controlled in the house. Many of these patients have gone back to work because the pain is now completely controlled.
Recycled plastic water bottles are filled with brightly coloured solutions. The bottles are full of oral morphine, colour-coded for the different strengths. Green for the weakest, then pink and blue for the strongest.
Almansi is a 74-year-old man who has prostate cancer diagnosed some years ago. It had spread to his bones, and because of causing pressure on his spinal cord, he ended up with some degree of leg weakness and bladder and bowel problems. The main issue he described was having very severe back pain when he was first diagnosed, and that has been eased down an awful lot by the use of morphine and various pain medications that he's been prescribed. So he's actually in really good form at the moment, and you can't see it because of his dress, but he's actually rather frail when you see he's lost an awful lot of weight, but he actually seems really comfortable at the moment.
Saying that he doesn't have money of buying milk.
The nurse prescribing arose because there was a terrible need for people to prescribe. When we work out the number of people in Uganda at the moment who need pain control at this moment, it's something like 200,000 people. Now, these doctors out there have to do the gynecology, they deliver the babies, they do the cesarean sections, they do the surgery, the major surgery, and they look after the children who are very, very ill, and, you know, so they have so much to do, and that they could not prescribe for maybe 100 patients a week for morphine. So we had to increase the prescribers. So we put this across to the Ministry of Health, who took it to the Parliament, and they had this statute which allows midwives to prescribe pethidine for women in labour. And we asked them to change it so that people who we trained for 9 months in palliative care and in prescribing could prescribe morphine. So now we are increasing the prescribers slowly by slowly, very slowly.
Access to morphine is clearly inequitable around the world. Something like 80% of global consumption is confined to just 6 Western and rich countries. The remaining 20% is shared between 142 countries. It's a particular marked problem in Africa. The average consumption per person per year across the African region is 18 times lower than the world average.
Afsa, she's a 39-year-old lady. She was married and she separated with her husband. She has 5 children. Since she fell sick, they have never come to see her.
Night and day.
I think Afsa wants to see her children and her children want to see the mother. But the father has refused to let the children come to visit her. You see, she's really very sick, but she's hanging on. Maybe she really wants to see her children. Sorry.
Hi, Mama.
In a busy western suburb of Kampala, Mulago Hospital has a cancer treatment centre. Burkitt's lymphoma is a curable form of cancer that doctors often see.
Burkitt's lymphoma is extremely common in Uganda and actually in a belt across Africa, and so much so that Burkitt, who actually described it first in Uganda, thought that it was related to the mosquito or to malaria or the Epstein-Barr virus, and we've never actually got to the bottom of it, what it is really related to. But it's a tumour of the lymphatic cells, and many of the children present with a huge growth on one side of their face.
Hospice team member Dr. Charles visits the centre 3 times a week. The hospice provides not just pain control, but also pays for the first course of chemotherapy in an effort to cure these children.
Okay. The mother is telling me that he's now feeling a lot of pain. The tumor was a little bit small, but now it is increasing in size.